So Cushing syndrome is equal to Cushing's disease plus ectopic source. So Cushing syndrome means increased level of ACTH in blood. But Cushing's disease means the main reason is pituitary adenoma. So here you have increased ACTH in the blood, and the reason, if it is pituitary adenoma, it is called Cushing's disease. In ectopic source you have odd cell carcinoma of lung and carcinoid tumor. So Cushing syndrome you can divide into two. What are the two types? ACTH dependent, ACTH independent. So Cushing syndrome is actually increased level of cortisol in the blood, okay? Increased level of cortisol, not ACTH, cortisol. So it can be because of ACTH dependent cause. ACTH dependent cause means because of increased ACTH, increased cortisol. So examples are, one is this pituitary adenoma, another is ectopic. In both cases they are producing ACTH, thereby you have increased cortisol. Now one more thing, you have ACTH independent. So what is ACTH independent? That is directly producing cortisol from site of production, that is from the adrenal gland, from the cortex of adrenal gland. So that is adrenal adenoma. So one is ACTH dependent, ACTH independent. So ACTH is responsible for producing, it is having a melanocytic like action. So it causes pigmentation. So here you have ACTH dependence. So there will be pigmentation. Here it is independent. So pigmentation is absent. So what is Cushing syndrome? What is Cushing's disease? What is the difference between these two? So basically you have increased cortisol. So in one case the problem is in the pituitary. In another case problem is ectopic. Then it can be ACTH dependent, ACTH independent. What are the examples? Where you get pigmentation, where pigmentation is absent. So here ACTH dependent you have got two causes, pituitary adenoma and ectopic. You have to differentiate between these two, 1 and 2, pituitary adenoma and ectopic. So in ectopic cause, it is actually fast growing, so the clinical features will be very rapid, okay, very fast. Here it is very slow. Now we will discuss about the clinical features. Okay. So another reason that can produce, another example for ACTH independent cause is exogenous steroid. You are consuming steroid from outside, so there will be increased level of cortisol level in the body without increase in ACTH itself. So next we will discuss about what are the clinical features. So clinical features include we have to know what is the function of this. So there is a particular appearance, isn't it? See, actually it is the adrenal cortex and this is the adrenal medulla. So we know that from the cortex you have glomerulosa fasciculata and reticularis, mineralocorticoid, glucocorticoid, and 6-corticoid. So here there is increased level of glucocorticoid. So in this case there will be moon facies. The facies will be moon. There will be a buffalo hump. An abdomen you have striae. Proximal myopathy. So the centripetal distribution of fat. So the limbs will be thin. And another thing is striations in the abdomen, purpura, delayed wound healing. Now, action of this glucocorticoid, it is to increase the blood sugar. So blood sugar will be increased. There will be some action of mineralocorticoids, so sodium water retention, hypertension. Hypertension, and it is low renin hypertension. Same time, here what is happening? Mineralocorticoid is aldosterone. So aldosterone will be high, causing sodium water retention, causing hypertension. Potassium will be secreted out, so that is metabolic alkalosis. So along with hypertension you have metabolic alkalosis. So for investigation, for all the tumors and all, you can do CT abdomen, MRI brain, like that. Then and everything you will have a test. Here it is. You can look for urinary cortisol, 24-hour urinary cortisol. So here you can give low dose dexamethasone. Low dose dexamethasone and high dose dexamethasone. When you give low dose dexamethasone, it will suppress ACTH production. In which case, ACTH dependent case. When you give high dose dexamethasone, it will suppress adrenal adenoma. When you give low dose, ACTH dependent tumor ആണ് respond. So low dose dexamethasone, that is low dose steroid. What happens in ACTH dependent tumor will stop their production. You can say decreased ACTH. When you give high dose, which one responds? Adrenal adenoma. So what is not responding? See, low dose, I want to clarify it again. Once again, okay. This is low dose when you are giving steroid from outside. You are giving steroid from outside. So in that case, ACTH will be suppressed in exogenous, this one. Because steroid feedback mechanism inhibits ACTH. But in that case, if still ACTH is high, it could be these two cases. That means there is a tumor producing more ACTH. So since there is a tumor producing more ACTH, you have to give high dose steroid for suppression. So high dose steroid is given for suppression, and it is suppressing means it is a pituitary adenoma. In ectopic cases, you cannot suppress. So as a part of treatment, steroids can be given from outside to suppress ACTH, okay, as we told now. Then you can taper steroid, you can give alternate drug. In adrenal adenoma, pituitary adenoma, you can do the surgery, transsphenoidal surgery. Medical adrenalectomy can be done, like ketoconazole. And surgical adrenalectomy will, that condition is actually called Nelson syndrome. So we know that from the pituitary ACTH, then to the adrenal gland, and they are releasing cortisol. So just imagine that adrenal gland is gone, then you have no cortisol. So in that patient you have to give lifelong cortisol should be given. Can be hydrocortisone. So all we are giving this lifelong hydrocortisone. So usually cortisol is in a pulsatile manner. Here it is continuous, not pulsatile. So there is no feedback mechanism. Therefore ACTH will be still high. Therefore pigmentation will be present. Pigmentation will be present. So what is the reason? It is not pulsatile manner. Since it is not pulsatile, no feedback inhibition. So this is about our topic, okay. What is Cushing's disease? What is Cushing's syndrome? What are the causes? How can you differentiate the causes? ACTH dependent, independent. Then what are the clinical feature, diagnostic, investigation and treatment?